Good afternoon. Here we are with Mr. Bob McCurdy, who we've spoken to before, and we're now getting to the meat of what we really want to discuss, which is, Bob, we had an instance of prostate cancer.
That's correct.
But just over 18 months ago. Now, there are many regular treatments. Bob decided to go a different route, which, as you can tell by looking at him, has been working for him very well, and he would like to give us more information on that, please, Bob.
Okay, well, I think probably best if I say how I found out about it and how we detected it, was that a number of years ago, when I had a general medical, my GP at that time, when he got all the results, said to me, your PSA count, your prostate-specific antigen count, is a little on the high side, and that would be something that going forward we should look at on a regular basis. And having said that, I was healthy enough, I didn't think any more of it, and I didn't do any more, and I hadn't had any further reasons to have further medicals. However, about slightly longer than 18 months ago, I had what I thought was a urinary tract infection. I was having burning sensation when I urinated, and I was having spotting in blood spotting in my urine. So it was time to go and fess up, and I found a urologist, Dr. Yip, very nice gentleman. Went to see him. He immediately did an ultrasound to find that my prostate was enlarged, which is not, it's common in men as they get older. And armed with that and a new PSA test that showed that my PSA was very high. So he then started me, first thing he did was that he sent me off for a MRI, a PET and CT scan. And that showed that I had tumours, cancerous tumours in my prostate.
Tumours, plural.
Tumours, plural. His recommendation from that moment was he did a biopsy as well, and the biopsy showed the presence of cancer. So that confirmed the findings.
So you would know where we are at that point.
With what I know now, I would not have had the biopsy, because from a lot of what I've read and a lot of what has gone down with other people, the very act of putting needles into your body to extract tissue, to perform a biopsy on that tissue, is going to be moving tissue and blood
spread the infection,
which can potentially spread the problem elsewhere. But that, by the way, is just a side effect, and I didn't do that.
And if you didn't have a biopsy, though, how would you confirm it was cancer?
By the PET CT scan.
Okay, right.
Because they infuse into you, they put in into a drip into your vein, and it shows up as cancerous cells within the body. So the scans confirmed, and in my case it confirmed that there was tumours in the prostate, and there was some metastasization of cells that had gone outside to the seminal vesicle, which is close by, potentially into my pelvic girdle, into the bone structure.
Everywhere around about, yeah.
So not tumours, but the presence of cancerous cells.
Right.
So I was sent to an oncologist, and my wife has been very, very supportive of me. Angie has been with me every step of the way. She knows what we've done. She's been supportive of that. She's come with me to Germany, and I'll go into that as we go through the tale. The oncologist, another nice gentleman, sat me down, and he said, right, together we're going to tackle this and we're going to win. And so he said, the approach will be as follows. I'm going to put you on a 3-month course of hormone treatment. And the hormone treatment, which is basically antigen, will temporarily, hopefully, was the word he used, reduce the size of your prostate by 5 to 10%. That's the effect of the hormone treatment.
And these are female hormones or male hormones?
These are hormones to reduce the testosterone.
Right. So yeah.
Androgen blockers.
Right. So it's a reduction of
yes.
testosterone.
When I've finished that course, he will then 1 hour a day for 6 weeks will irradiate me through radiation using a computer-controlled system to pinpoint the tumour in my prostate and burn it. So that was his approach. So course of hormone to reduce it, and hopefully, and this is the word he used more than once, that this will reduce the prostate in size.
It's not filling me with confidence.
And the reason, and he said that the reason that they do that is that so that when, even though the radiation treatment is computer controlled, your body is under constant movement and pressure because you've got liquids, solids, and whatnot have you inside, as you can't keep everything still, and everything is moving around to a degree, and therefore he wants it to be reduced to hopefully reduce the potential of burning other tissue in the vicinity.
Right, so basically if it wavers a bit, it can destroy something that's useful as well as the
and from my readings in other places, it has caused people to be incontinent, impotent, etc. So Angie and I went away, and we thought about it, and I said to her, I said, do you remember my friend Steve? I said, Steve was a good golfing buddy of mine from New Zealand, and he and I played a game of golf 3 years before this incident, and we sat in the balcony having a beer afterwards, and I said, I hadn't seen you for a while. He said, no. He said, I was away having treatment. He said, I had prostatitis, he said, which could lead to prostate cancer. And he said, and I went through this whole procedure with the doctors, the urologists, and everyone else. And he said, and I went onto the web and I found an alternative. And the alternative is in Germany. And it's a procedure that's known as hyperthermia. It's the application of heat to kill cancer cells. And he said, so having looked at this, I contacted the clinic in Germany. The clinic is called St. George.
Steve contacted the clinic.
He did for himself. He contacted the clinic. He sent his results, his PSA, his blood tests, and other things that the doctors had told him. And the clinic said, you're a prime candidate. And he went to Germany for the week, and he had the procedure. And what he was telling me over a beer is, Bob, if this ever happens to you, remember that, and that's a good option as an alternative.
And he was cured by that?
Yes. He said that he has been 2 years, his PSA has reduced, his prostate has gone down in size, and all his bodily functions have gone back to normal. He said the only thing, if anything, he said, I've put on a little bit of weight, he said, which I've struggled to get off. He said, but that's maybe partly to do with my age and the fact that I'm working too hard and not exercising enough. But be that as it may. So there I was, Angie and I sitting down, and I remembered the discussion with Steve. So I sent him an email, and we had a Skype call, and I explained what I'd had, and he said, well, look, I said, my recommendation would be for you to contact the clinic and see what they have to say. So we established that contact with the clinic in Bad Aibling, just south of Munich, sent them the results, had a very good backwards and forwards communication with Frederica, who's basically the admin director, and she looks after all the admin stuff and passes it to the various doctors. And the answer came back, look, they believe that I'm a prime candidate for their procedure. And they outlined what the procedures were. And I was given the description, which is basically you come to the clinic for 5 days, you stay at a hotel so you're there as an outpatient. You come for morning session, afternoon session of about 3 hours apiece. There's days 1, 2, 3, 4, and 5. Days 1, 3, and 5, they do what's called a general hypothermia, where you lie on a bed and you have a cushion underneath you, a device on top of you, and it heats the torso area. And the idea there is to heat it up to a temperature of about high 40s, where they believe that above 36, 37 degrees, cancer cells die. So days 1, days 3, days 5, I get this for 1 hour. On days 2 and day 4, they actually do an prostate hypothermia. They introduce a cathode with a catheter, and it gets excited by high intensity radio waves from outside the body, and it heats up from within. And it heats up the specific area, and it's controlled by ultrasound. So the doctor is controlling the positioning right inside the gland. And he's controlling and monitoring the heat. And he brings the heat up. He also monitors that your comfort level. There's no discomfort from the heat.
No, that's what I was going to say.
No,
Do you
there's more discomfort from the general because what tends to happen is you sweat.
I'm sure.
And as you sweat, you actually your sweat becomes very hot.
Right.
And so what they do is they pull it off and swab you down and put it back when you're dry and carry on. So that's the 5 days of the hypothermia treatment. But in addition to that, the Germans believe that they've got to put your body into the best balance that it can do its own fighting of any cancerous cells anywhere. They want to take you to where you should be. So they do what's called chelation. And chelation basically introduces into your body a substance that gets rid of all heavy metals and the stuff that shouldn't be there.
That you've accumulated over the
years.
Yes.
They also put you on a drip 3 times a week of vitamin C. And in addition to that, they do an oxygenation of the blood by ozone treatment, where they actually take it, they put you on a drip where they extract blood, they oxygenate the blood, and they put it back in again.
And how did that feel? Was that good? Because oxygen, I believe, did it give you a little high or
a little, yeah, perhaps.
Did you feel a bit more energetic or anything? No.
I was feeling. I mean, I was feeling that things were working, and I was very positive. If I can just sort of go back a step, so that was the description of what I was going to go through. So Angie and I then said, and this was in November, in late November. So we went to my doctor.
Last year?
No, the year before.
Yes, so this is 2018, 16.
17.
17?
Oh, I beg pardon, 16. 16.
Yes.
So in November, we went to see my urologist and told him that the decision that we'd made was that I was going to go to Germany for treatment, that the German clinic had oncologists, urologists and surgeons there, and that they had a procedure that had been in use now for 23 years with a high level of success, and that and he said that would not be my recommendation. He said, I think you should go for the radiation and possibly downstream chemotherapy. So,
of course, what would you expect him to say?
Now, Angie, being a pilot, she runs her whole life is run from a business point of view by her roster, and so we then said, right, how will we go about this? And Angie said, well, first thing is I'm going to get time off work. So she contacted crew control of Cathay, explained that I had a problem with cancer, that I had to go to Germany for treatment. They looked at her roster and said, right, how long do you need? She said 10 days, 12 days. So within that core of 10 days that we would go, they said, right, you've got 3 flights in there. So we'll take these 3 flights away, giving you the total of the time that you need. And we will then take those 3 days off your annual leave. Simple as that. You know, just straight up. Yeah. They were very, very good.
So there was no...
They came straight to the party.
They were...
None of that at all. None of that at all. And the further statement was, and if you need more time, let us know. So you couldn't get better support. Yeah, better support than that. We didn't consider the pricing of this to be an issue. I have an insurance through Cathay's Medical as a dependent of my wife, and they were covering the costs in the main of my tests and doctor's appointments, but they wouldn't cover Germany.
Well, that was going to be my question. Yeah, they cover all the mainstream stuff, but when you step outside,
they covered everything here, and and with me stepping outside it, that wasn't covered.
Wasn't covered.
However, the German procedures for a week cost €6,500. So you know,
it sounds like it sounds like a lot of money. But if you're dying and you would have other, it's not a lot of money at all. A holiday costs more than that.
We had spent the thick end of about $110,000 Hong Kong just on the tests up until that point, the majority of which was covered by insurance. Yeah. So €6,500.
Wasn't going to make any odds either way.
No, and so
that's the treatment. €6,500.
Yes, and you're obviously
all of the drips,
everything. And
Okay, in Germany.
in Germany. And obviously getting there was our expense.
Yeah,
Being in a hotel was our
yeah,
expense.
yeah.
One of the things that I found quite amazing was that when I arrived at the clinic, and one of my first questions was that obviously I'm staying in a hotel. What about food and drink and what have you? And they said, look, we're not putting any chemicals into you. There is nothing there that say an alcohol, a beer or a wine would have an effect on. You just lead your life as normal. You can go to the pub in the evening and have a beer.
Yeah.
In fact, the German beer is very good.
And we'll be there as well. Yeah.
Correct. And so, right, so Angie got her time off. She organised us to get on a flight to Frankfurt. We took a train at Frankfurt airport straight to Munich, got a local train down to Bad Aibling, presented ourselves, and we couldn't get there over a weekend to start the procedure on a Monday. We couldn't actually get there in time, so the procedure itself started on a Tuesday.
So where is this place? In Munich?
Munich is
it's a
Munich
provincial town?
Yes.
Right, so
It's a spa town.
It's a spa town.
Spa town.
Right.
South of Munich, 40 kilometres south of Munich. And it's been a spa town for a long, long time.
Mm-hmm. One of these old Victorian spa places that's,
Old Bavarian,
yeah,
with the Papa and the lederhosen.
Right,
Yes. So we get to the clinic, and we'd already explained to them that we couldn't get there to do Monday to Friday, and you can tell that the Germans they're not there specifically to make money out of medicine. They're there to make people well.
Right.
And it's very obvious by the amount that they're charging you. Mm-hmm. The procedures are fantastic. The place is a wonderful place. It's so spotlessly clean. The people are nice. Everybody's nice.
This is the town, the clinic, the whole experience.
Yes,
right?
everything. The whole experience was really, and the hotel itself that we had was really beautiful. And the Germans, their worry, not the worry, but a small concern is that if you couldn't actually get there to do Monday to Friday, that meant that you'd go over a weekend, which meant that your expenses were going to be higher than it would normally. But in our case, that was not part of the consideration. And as it turned out, our wedding anniversary was on the 17th of December, and we managed to go to Munich for the day and and do museums and go to a nice restaurant, a couple of pubs, and got into the beer and what have you. So the whole experience from start to finish it's not something that I would go to for no good reason, but I had a very good reason, and what you go through is not difficult. It's not. There's not parts of it that make you feel hugely uncomfortable.
So you're not lying on the bed going, "Oh, what's that?"
I'm certainly not. I'm certainly not.
Stirrups and this guy.
Yeah. Not at all. You're lying there with a drip in your arm for the various things they're putting into you, and I've got my computer here, and I can and Angie would come in. We would sit beside me and we could play a computer game.
Right, so basically it was like having visiting hours in a hospital.
Yes.
You could get in and you could do your stuff.
Yes.
There was no an anaesthetic or need for anaesthetic, pain.
No, they gave a small local anaesthetic when they introduced the catheter.
Right. Well, good. Okay.
Right. So there was no discomfort, or discomfort was minimal. So I didn't. That was probably the one thing that I was dreading, and
yes.
And I was not. I was
not put off by it.
I was not put off by it, and nor should anyone else be. End of the week, going through the procedure, the doctors were very informative. They always let you know what was happening.
And all English, I'm sure.
Their English was superb.
Yeah.
And everything that we went through, and at the end of the day, we were then recommended. The recommendation was that I should stay on the hormone treatment for 6 months. That I would have one.
So they gave you the hormone, or is this the hormone, the initial hormone?
They gave me the hormone. They gave me a hormone treatment in Germany to get me started, right. And I had 2 injections. One to be taken then, which I did. One to be taken 3 months later, and a day and night hormone tablet for a full 6 months, and to monitor my PSA. So we came back to Hong Kong.
So that was it.
That
was December 2016.
Yes.
Came back to Hong Kong for Christmas.
Yes.
You had your hormone injection, you had one for 3 months, and you had your pile of pills to take
I did.
during the time.
And went back to see my Hong Kong doctor, told him what I'd done. He said basically he still didn't trust. This was not the procedure he would recommend, but he would go along with my decision. And he also said to me that we'll obviously monitor your blood, and the recommendation was that first of all, after 3 months, do a blood test.
Sure.
And then a couple of blood tests every 6 weeks after that.
Right.
And my PSA level, which had shot up as high as the 60,
60?
yes,
That's a lot.
plummeted initially to 21, then 17, then 11.
Because it should be under 5, should it not?
Well, it went all the way down to 1.9.
60?
Yes. No, that's quite close.
Well, that wasn't good.
It wasn't good, but it's an indication of activity and not an indication of cancer.
Oh, right.
That's
okay.
the thing that's important to know.
Okay.
It's-
Explain that then.
I'm a layman. I'm not a medical man. What I believe is that as you have activity within your prostate, the PSA, the prostate-specific antigen, it is present in your blood and is activated, and it shows up when you do a blood test. That shows that there's something abnormal.
Okay, there is activity in that area.
And the abnormality can simply be prostatitis, which is an enlarging of the prostate.
Which Steve had.
And or cancer as well.
Right.
So both of these are possible. So we saw a very quick decline in the PSA, which was a good indication. And my
How
doctor...
did you feel at that point? Because obviously when you're told...
Elated.
Yes.
Totally elated. As soon as it started to plummet, then I thought something good is happening.
Because
we've made the right decision.
Told you get cancer, obviously that's the number one thing in life, apart from your mum and your kids dying, that you don't want to hear.
Yes.
So that takes you down.
That's
but then
bringing
when
me
you
down.
hear I might just get myself through it. That. I mean, it must give you a rush.
It did, and we were elated, and we then made a mistake. Okay, my doctor in Hong Kong said that once the PSA has steadied, then the recommendation would be to take me off the hormones to allow my body to go back to normal. Okay. Now, my mate Steve, and the discussion that we'd previously had, he said to me that by the time he had steadied, he decided to do away with the second injection, and he went off the pills within 4 months. Now, that was his decision. We, having seen what was happening to the PSA result, we decided not to have the second injection, so we just ignored it. We finished off 5 months of the drug, and we went away on holiday, didn't bother with a blood test, assuming that things were heading in the right direction. Aha. We were wrong.
That assumption is always the mother of all, as they say.
So we came back from our leave, which had been to the UK, had a wonderful time, went to Scotland, went boating, did a whole bunch of clever things with friends and relatives and what have you. Returned to Hong Kong, had a blood test, and whoops. We had been warned that there would to expect a spike when we came off the hormones, but this was a large spike. This was a spike that went up.
Did Germany know you'd come off the hormones? Did they know you hadn't?
No, they didn't know anything at this stage.
So you hadn't consulted them?
No, I hadn't consulted them, hadn't consulted anyone. We'd made the decision.
Yeah. Okay.
I said, this is what I want to do, and Angie said, okay. Because the rationale also was the hormone pills artificially masking the fact that I've got an ongoing problem? And how would you know? So by coming off the pills, let's see what the problem really is. So, big spike, bigger than we thought. So, went off, and we contacted Germany, and Germany said, run a series of scans again, and send us the results. So we organised through the doctor here. You need a specialist to recommend that you have. So I went back, and I had another series of MRI, PET, CT scan, and that showed a number of interesting things. It showed that in the previous scan there had been some cancer cell activity close to my pelvic girdle. It showed that those cancerous cells, there was less of them than there had been before.
They've been dying off.
And that seemed to indicate that there was a control of that. There was still some activity near the lymph area, but the good news was that there was nothing from head to toe, similar to the previous scan, to show that there was any other part of my body that had a problem.
And you usually expect to see bits
You may,
and bobs popping around.
you may,
Right.
and you know if,
But
if
not, yeah, and that's when things get. Really
that's when
serious.
things can get really nasty. So that was, there was 2 bits of good news in there. Sent that off to the Germans, and the Germans quite calmly said, "Come back for a second treatment." And that's what we did, and we went back
Well,
for.
you still got stuff, so.
We did, and the way the Germans explained it is this: their statistics have shown that I'll pluck a number out the air, but I think I'm fairly close to the truth. Their statistics have shown that they treated 200 men over a period of time for prostate cancer by the use of hypothermia, with an 85% success rate of total eradication of prostate cancer. There's a 15% that's not included in there. So what happened to them was my question. And they said that 15% came back for a second dose, and after 10 years, that test group of 200 men, not one of them have died in a period of 10 years. Now that's 100% success. So 85% the first time around, and the bit that didn't work.
You think you ask about, they go, well, they came back
And the lovely Dr. Diana Uzanova, and she said a number of things, and she said, "I'm not going to give you a bad time for going off the medication, but if I tell you to go on the medication, please go on the medication."
Very subtle way of saying, "Look, son, do as you're told." Okay.
And she then said to me, she said, "You know, Bob," she's like my granny.
Yeah.
She said, "Statistically speaking, every man from the time of mid-30s will have cancer cells in the prostate.
Right.
In most cases, those cells get flushed out of the body naturally.
Okay, your body will naturally flush them out.
Flush them out. Of the ones that don't, some of them may grow into non-aggressive small tumours, and some of those should be left alone.
Yes,
Because
benign.
people will die with it, but not of it.
Yes, okay, yes,
Right?
yes.
So that was the explanation. But when it has become aggressive, we have to treat it, and then this is the treatment that we're recommending, and we have seen success from this. And the success has been over a period of 23 years. This is not something that's new. The Germans have been doing it for a long time.
So who was the guy or the woman who first came up with this? Who was the Marie Curie for the...
Dr. Dowis, who's the director of this clinic.
And he's still alive?
He's still alive and still there and still in harness, and his daughter works in the clinic as a doctor, and he's there. And he has trained other doctors throughout Germany, and there's now in excess of 40 clinics doing this procedure.
So there's 40 clinics in Germany?
Germany-wide, and it's now recognised by the German authorities so that you can have this covered by your insurance in Germany.
Right. And is it only in Germany?
There's a couple of clinics in Switzerland.
Right.
I think there's one in Holland, and I think there might be a couple in France.
But it's not global, and it's not. It's very much a German.
Very much so. I have a book which I can show you, and you do a quick read through, and you can
Sure.
read a lot more about it.
I'd love to. What was the question? There was a question. Quick. What was it? Other cancers. So prostate. Your case. Do they do other cancers as well?
They do, and they've also come up with the first one. To answer the first question, while Steve was in the clinic some 3 years before, there was an English lady that came in, a young lass in her early 30s, and he got to speaking to her, and her story was that she had breast cancer. And the recommendation was radical mastectomy and radiation and chemo.
The whole thing. Yeah.
And she decided against that. She investigated it. She contacted this clinic and asked Dr. Dowis if he could perform the hypothermia on her tumours.
She was English.
She's English. And he said that this was not this had not come up before. This was not something that was standard, but he would review her case, which he did, and she came, and she had localized hypothermia on her left breast, where the tumours were. When Steve actually met her, she had come back again, and he said, "So it didn't work." She says, "No, it worked perfectly well. I've got tumours in my right breast. I've come back to get it done properly." Now, my tale is slightly different. I was sitting on a drip in the clinic and reading, and there was a German gentleman beside me, and he was having his drip as well. And he started to speak to me in German, which didn't work because my German's not very good. If he'd tried Chinese, it might have been a bit better. But so he then said, "Where are you from?" And I said, "Hong Kong," and nearly fell off the chair. I said, "No, Scotland." But so we got to chatting, and I said, "How do you know about the clinic?" He asked me about the clinic, and I said I'd heard from my friend Steve, then went online, and then blah, blah, blah. I said, "What about you?" And he said, 25 years ago, Dr. Dowis cured me of fourth stage lung cancer. I said, "And why are you here?" He said, "I'm here for the same reason as you. I have prostate cancer, and he will cure us."
Just like that.
So for 25 years ago...
Well, fourth-stage lung cancer 25 years ago, you would basically go home and get your affairs in order.
Correct. So that was more than encouraging.
So, but what, like all these things, why isn't this a global phenomenon that everybody's telling everybody about?
Well, let me just finish the one other part before I forget it. During the process of his doing this hypothermia studies, he had a patient that came to him who had cancer problems, but also suffered from Lyme disease.
What's Lyme disease? I've heard of it.
It's tick-borne disease that affects the brain, and from what I can tell, patients can be bedridden. They can go. They're lethargic. They can't walk. They end up in
degenerates the brain.
Yes.
And whatever symptoms come from that.
He cured Lyme disease
with the thermal.
Yes.
And is it a cancer?
No, it's not.
So what does it? How did he cure that then?
By hypothermia. It worked for Lyme disease.
It worked for that.
So, and there's a bit in the book. So without,
as I said, rather than getting into
yeah,
details.
well, I can't because I can't describe the medical issues associated with it. And so he's now getting patients from North America, and mainly because that's where the Lyme disease in the main comes about. North America, Canada, and Australia as well.
Right. Okay.
And that's where all. So he's getting lots of patients now going there, and they're being cured of Lyme disease.
And they've been cured.
They've been cured. They've been cured. And I'll point to the bit in the book, so for your own reference, you can...
Well, when we get to the end, give the name of the book, give the author of the book,
Yes.
names of the clinics in your email, and...
I'll do all that.
Yeah, and
I'll do all that.
Everybody can decide what they want to do after that.
Yes. Now, the other question you were going to ask me was when I got sidetracked. What was that?
Oh, it was, why isn't this a global phenomenon?
Now, this is my belief. Okay, my belief. And it's partly to do with the fact that the big pharmaceutical companies are making squillions of dollars off chemotherapy, radiation equipment, and the drugs that go in support of all of that.
So the big pharma cartel, basically.
The big pharma cartel is making lots and lots of money out of cancer.
Oh yes.
And other diseases. This procedure is cheap.
Oh, it's cheap
as someone in America pointed out, that for their cancer they could be spending $10,000 to $20,000 a month in the drugs associated with keeping their cancer in check and what they're going through, and for the price of a second-hand Honda Civic, you can come to Germany and have this treatment and be cured.
And there's no profit in that if you're fine. Well, I won't mention any names if you're a big pharma company.
And there's moves afoot in America to try and curb the excesses of the pharmaceutical industry, where a lot of money is being channeled into the payment to doctors, in particular, who take on these drugs and put them into their own pharmacies within their own clinics, and then double the price and charge the clients, and everybody's making big bucks.
Yes, everybody's making out like bandits.
And the government Food and Drug Administration, who are supposed to monitor and control and set up the testing mechanisms, their salaries are paid for by the drug companies.
Yeah, in therein that's innate corruption right there.
Putting the fox in charge of the hen house.
That's right.
So I believe, and others are of the same belief as me, but this is my personal belief. My personal belief is that, and this includes my own doctor here in Hong Kong, they go through training, and the training is the same for everyone. And that training basically is the same training that's been going on, and it's focused on the way people have been doing it repetitively for a long period of time. Now, President Nixon declared war on cancer in the 70s, and they still haven't found a cure. Now, why is that?
They don't want a cure. It's like the war on drugs.
It's a wee bit like that. Now, the Germans have had more than one cure, and there's a lot more cures coming down the pipe as we speak.
And are they're physical cures or pharmaceutical cures in Germany? Because hypo thing
it's physical.
That's a physical
there's
cure.
There's no drugs involved.
No drugs involved.
There's no drugs.
That makes a lot. I mean, the heat thing. The thing about it is, it sounds so simple, but if you think, it's like, why not? Why wouldn't it be simple?
Yes, and there's a famous case of a nun in the Catholic orders whose body was riddled with cancer. I'm talking about a couple of hundred years ago. And the expectation is that she would die, and she'd been given last rites in the whole 9 yards. And somebody came to say their goodbyes who had a flu, and passed on the flu to her. And while she was she went into a raging fever, and the cancer disappeared.
Died. And that's documented somewhere?
That's documented.
I get there.
These are anecdotal stories.
Mm-hmm.
Now,
what you've done and what the doctor's doing, and 40 clinics in Germany, that's not cheap to set up and run.
No, it's not.
And if people are dying off like flies, they wouldn't be going there. So,
correct.
Simply by dint of the fact that they exist, they're doing something correct.
When you go to Dr. Dows's clinic, the Clinic St. George, there is a map on the entrance hall, and the pins are sticking on the map from all over the world of patients that have come to be treated at his clinic. Mm-hmm. And that's a wonderful legacy. Mm-hmm. The people are amazingly good. They're nice people. They explain things. Their communication skills are fantastic. And they make you believe. And they make you believe that their treatment works.
Well, they must believe themselves because they've seen the effects themselves. So they know, they're not saying like your doctor here in college saying, hopefully, they're saying, well, George was here last week and we've been, he was here 25 years ago with his lung cancer.
That's right.
And he's come back 25 years later for his prostate.
Yes.
So they know it works.
They know it works.
So that must give the whole place an ambience of hope, rather than you walking into a high problem ward in a hospital. It's like walking into a morgue, you know?
Yes, this is not like that. And since having my second treatment, and the second treatment was modified slightly.
When was this, date-wise?
So date-wise, this is now end of October, first week in 2017. So I had the spike.
Same thing?
Oh, not quite. The second go-round, they then looked at the scans, and then they made the decision that they didn't need to do the intra-prostate heating up, but they would use a new system that they had developed to do a general heating up of my whole torso. Yes, and so I still continued to have the days 1, 3, and 5 of the 1 hour, but for days 2 and day 4, there was a specific controlled small area torso heating up.
So they could give a more intense
Correct.
heat, or in a more intense area.
Yes,
okay.
and again computer controlled, and no side effects at all.
And no pain.
No pain whatsoever.
You just feel like you're getting warm.
A bit warm.
Right.
Yeah, and so that was done, and the recommendation for me to get an injection there, another one 3 months later, and
this is hormones.
The hormones. And I'm now 5 months into that.
And you took the injection this time?
Yes, I did, and the second one.
Right. and
Dr. Uzanova will be after me. She'll find out, and she'll...
And the latest test or scan you've had, when was the last one you had? Or when?
Last week.
Okay, and?
3.2.
So that was your... So, well, 3 point... I think I was a medical in December, and mine was like 1.9 or something. You was at 16, it's now 3.2.
Yeah.
So that's pretty good.
So going forward from here, we will continue the medication. I'll be seeing my urologist next week to say, look, this is where I am, and I will need him to prescribe more medicine if needed. We have already sent the PSA results to Germany, and we will get a reply fairly soon. Now, one of the concerns that we have is that the PET CT scan is very invasive. It's like having 100 X-rays.
Oh, right,
and
the radiation itself.
The radiation. And so the radiation itself can cause cancers. So you don't want to be doing them too often.
Right.
And so what I want to know now is there another method whereby we can now look at my body to see if there's any stray cancer cells anywhere?
Yeah, without frying me again.
Yes. And in the meanwhile, I'm not only taking the daily hormone treatment until we've finished that 6 months.
And how does that affect you, the hormones? Have you felt any less manly because your testosterone is...
What do you mean? I giggle a lot and want to play off the ladies' teeth at golf.
Do a lot of your hair do a lot?
Well, it has I don't know if I've experienced any new hair growth because one of the hormones is supposed to do that. There's a couple of things that are side effects. I do get hot flushes from time to time.
Okay.
Yeah,
hot flush.
and it basically means that for a period of maybe 5 minutes, I develop a sweat.
Yeah, but you don't get dizzy or anything. It's
No.
just warm, right?
I just warm up. So that's one thing. I think I've put on a little bit of weight in the tummy area,
Well, if you've got
but I'm
cancer, that's not always a bad sign.
It's not a bad sign, but I've got a healthy appetite. I don't have any restrictions on having a drink. And people, when they meet me, say how healthy I'm looking.
Which you do. And you're walking around the golf course like twice a week as well.
Yeah.
So that's like 6
And
miles.
we walk into Saikong, Angie and I,
Right, so that's
on a
a few
regular.
miles. So, I mean, the fact that you can do that at all,
Yeah,
even if you hadn't been ill,
yeah. So
so you're pretty fit and healthy. Yeah.
So I'm looking forward to the day that I can have a scan that says I'm cancer-free. And if the answer is there are still some extraneous cancer cells floating around somewhere, what do we do to tackle those now, going forward?
And has that been asked? Did you ask?
I'm asking that question of the Germans.
Of the Germans, right
Of
now.
the Germans,
Yes.
yeah.
Quite rightly. So.
Yeah, and then we'll see what comes of
See
that.
what comes of
So we are very positive.
Yeah.
It was a bit of a knock in the head. In fact, it was when I came back from my holiday and got the result and showed the spike. I didn't believe it. I thought they'd given me somebody else's. So I went and got another second blood test that showed exactly the same thing. So that was a bit of a shocker.
Yes.
And if you
a roller coaster ride.
But I'm a very positive person. I don't dwell in the negatives. I'm positive. I'm very positive about my treatment. I'm very positive that Angie and I together have discussed it every step of the way, and every decision that we've made has been the correct one.
You need that support,
and I've got a wonderful woman giving me that support, and she has lost her own father to prostate cancer.
Right.
And
recently,
about 10 years ago.
Right.
So it's very close to home, and she wants to have an old man to go on holiday with when she retires, and enjoys playing golf and walks and nice meals in Saikong.
And just the fact that it seems miraculous that it's, because I have had a friend, just a younger guy than me. I won't mention any, but he had that, and he went for a different treatment, which just seems to be successful for him.
Yes.
And he had a spike the same as you.
Yes.
And he had to go back. It was one of those phone calls when, oh God, that's terrible. But he seems to have got it okay now. But his treatment wasn't particularly nice.
No, there's lots of treatments. I mean, the standardisation of the treatment is, cut it out, burn it, or poison it, which is basically surgery, chemotherapy, or radiation. Those are the three approaches that Western doctors, North America, Australia, Britain.
UK. Well, this guy got nuclear rods inserted in his prostate.
Yes.
Which did virtually the same as what's happened to you. They heated up the thing, and it killed the cancer cells.
Yes.
However, it was hugely expensive. I mean, medical cover, whatever, and it wasn't that pleasant. Whereas
Right.
what you did sounds like it's just you're going for a little holiday to Scarborough for a week.
It was, yeah.
And you have a lie down and someone heats you up. It's
No,
like,
it's probably still working, but I've got a blank screen.
Yeah.
That's normal, isn't it?
Yes,
Because it just goes off
normally
automatically.
did before the sun.
Mine does the same. Now, we're up to
45 minutes.
The things that I think are important is that when it comes to your body and your own health, you can't automatically just rely on the first person that you go to see. And I think it's important to investigate what is available out there. It's important to look at other success stories, like in our case, the Germans. I think it's important to look at the alternatives and not just take the standard cut it out, burn it, poison it routine. And I believe that the route we took with the Germans is the correct one for me.
I don't think anyone could argue with where we are right
Yes,
now in the
yes.
time space we've been looking at you and what you're still doing. I don't think anyone can argue.
And I think if I do need any more treatment of any kind, I'll be going back to Germany. And I'll be putting myself in the hands of people that I trust. And I think they know what they're doing. It may be possible that downstream I may need to have something different. But what I've had done doesn't preclude me having that.
No, that's right.
So that's the thing that's
it's
important.
Not putting other options out of the window.
Not at all. And that's the important thing.
And you've been allowed to enjoy your life and to live your life while getting treatment.
Yes, absolutely.
You know, you're not being feeling shit from chemotherapy and,
No.
and thing every day for 6 months.
No, that's right. I mean, my brother had testicular cancer, and he had one testicle removed, and he had chemo, and second treatment, third treatment, he was saying, oh, this is a doddle. By the time he'd had the fifth and sixth, he was not quite a wreck, but I mean, this is a guy who plays drums, and he's a very, very high level mechanic, and he had problems holding his nerves, and his hands had gone. And
Well,
it knocked him about very, very badly.
If you're on 5 and 6, the 6th level of the chemo, I mean, it's wrecking, it's killing you basically.
It is, because it's killing the good cells as well as the bad cells, and this is part of the problem. And the part of the problem with the radiation is exactly the same, because radiation is very good if they can actually focus it right down to an individual cell. But they don't. They focus it right down to an area, and if there happens to be anything around there that's healthy, that will get burnt as well. With the hypothermia, healthy cells get a suntan and recover. That's the way it's been described to me. Healthy cells get a suntan and
they
recover.
get a day in the sun, and the ones that don't like it get killed off. Yeah.
Correct. So going forward, I'm optimistic. I think that as I said, what we've done is, we believe, for me, has been the right way to go. Angie's totally supportive of me, and we're planning a future which has got many years in it. So these are important. I think we mentioned that for anyone who would like to contact me and have a discussion, then I'm very open to that. I'm very happy to share my experience, not to recommend any kind of medicine or way, but I can recommend that what I went through, I believe, is good for me, and it could be good for others out there. So, first of all, my email address is bobmccurdy, BOBMCKIRDY @hotmail.com. And if anyone out there would like to contact me and have a discussion, and where I can also give the contact details for them to proceed under their own.
What's the name of the clinic?
The clinic is called Clinic St George.
Clinic St George.
St George, and it's spelt Georg, no E on the end.
That's German George.
The German George in Bad Aibling, south of Munich.
South of Munich.
And the director there is Dr. Dowes, Douwes, and
the treatment is called
hypothermia.
just hypothermia.
Hypothermia.
So high temperature, basically.
High temperature.
Hypothermia.
Hypothermia.
Not low. Okay, hypothermia.